undergone it. Once you're good and frozen, your provider is going to make an incision across the abdomen, usually horizontally, and it's around this long, 10 or 11 centimeters, to accommodate the width of baby's head. It's above the pubic bone and usually buried into the bikini line, like this. Once through the skin, the next layer we come to is the fat layer, or subcutaneous tissue. It's a yellowish color like this, and the incision is also made horizontally. After the fat comes the fascia. The fascia is white in color like this. It's a tough, fibrous, connective tissue. It's all throughout the body, and it surrounds things like blood vessels, nerves, and muscles. It's also cut horizontally. Once through the fascia, we come to the muscles of the abdomen. A lot of people think that we cut through the muscles, but we actually don't. We separate them vertically and move them to the sides. Once these muscles are moved out of the way, we come to the next layer, which is a clear layer called the peritoneum. This peritoneum is a lining of the abdominal cavity, and it is incised vertically. Once the peritoneum is out of the way, we come to the uterus. But in the way of the uterus is the bladder, and we don't want to damage the bladder. So the bladder is pulled down and out of the way with a protective device that we use in the operating room. Once the bladder is pulled down and out of the way, the uterus layer is cut to gain access to the amniotic sac and the baby. Normally, this incision is done horizontally in most cases. However, sometimes in an emergency, this uterus needs to be cut vertically to gain access to baby that much faster. And then once this uterus is cut, the last layer we're going to come to is the amniotic sac. And this, of course, contains our amniotic fluid and our baby. Now, there's not really a beautiful science as to how providers cut into this amniotic sac. Some will use bandage scissors, some will pull it with a pair of forceps. Either way, it doesn't really matter because it's not staying in mom's body and it's not getting repaired. It's going to come out with that placenta. So as we can see, a C-section is really not a simple operation. It's a major abdominal surgery, as we mentioned, and our birthing people that have gone through this surgery and the recovery that's associated with it, congratulations.